Welcome to Medicare 101, a webinar that is going to cover all the basics that you need to know about Medicare and what you need to know before you have to make decisions. My name is Nicole Morgan. I am a licensed insurance agent and the owner of Morgan Medicare Solutions. Our team here at Morgan Medicare has a combined 40+ years in the healthcare and pharmaceutical fields. It allows us to holistically fit Medicare beneficiaries with the plan options that fit their healthcare needs now and for the future. We take a client-centered approach starting with education first. I know this webinar will spark a lot of questions, and if you have questions, we have the answers. Stay tuned to the end to find out how to contact us and set up a consultation at no cost to you. Let's get started. First, I'd like to tell you a little bit about Morgan Medicare Solutions. Our services are free to you, assisting in the Medicare sign-up all the way to plan enrollment. We are an independent insurance agency specializing in Medicare plans with multiple carriers, providing a non-biased recommendation based on your needs. Our practice model consists of education first, and we take a client-centered approach to all the plan research, and then we provide you with ongoing lifetime service on that plan just in case that you need a plan change later on in life. Here's what we're going to learn today: how and when to enroll in Medicare, the parts of Medicare and what they cover, Medicare mistakes to avoid, your Medicare options, frequently asked questions, and then setting up a consultation. Let's first talk about how and when to enroll in Medicare. But before you actually enroll, there's some things you need to know, some helpful hints before you enroll. The first thing you need to do is you need to have set up a Social Security account online. You can do this by going to ssa.gov. What does this account do? Well, in this account, you can check your Social Security earnings. You can also see if you qualify for Medicare, having worked 40 quarters or 10 years. And this is the avenue that you're going to sign up for Medicare. You're going to sign up for Medicare here, also Social Security or disability. But you want to have this account set up even now. If you're not even eligible now for Medicare, everyone needs to have set up a Social Security online account at ssa.gov. Then once you are on Medicare and you have a Medicare card, you're going to sign up for a Medicare.gov account with your Medicare ID. This account will allow you to search for Medicare plans in your area. You can check your Medicare claims if you take Original Medicare. You can also enter your drugs and save them in a drug list, and you can check the cost of your medications. It gives you an estimate with different plans in your area. You can also search for what Medicare covers and find out more about Medicare. When you are first eligible for Medicare, let's say when you're turning 65, Medicare is going to give you what's called an initial enrollment period. And it's 3 months before your 65th birthday. It is the month of your birthday, turning 65, and then it's 3 months after. That time frame of 7 months is your initial enrollment period. Now, if you're collecting Social Security before you're 65, you are going to automatically be signed up for Medicare A and B, and you will get your card in the mail about 3 to 4 months before the month you turn 65. Medicare always will begin on the first day of your birth month. However, there's a hidden rule in here that if you are born on the very first day of the month, that whole 7-month time frame to sign up shifts up by a month. So, for example, if you were born on April the 1st, then your time frame and your start for Medicare would be March the 1st. So if you're applying after 65, if you're over 65, it's still Medicare when you apply is going to begin on the first day of the month in which you plan to start. Now, if you're not collecting Social Security at age 65 or before 65, you will need to sign up for Medicare. You can do this, as mentioned before, going online through your Social Security account online at ssa.gov. You can call Social Security or go by your local Social Security office. Processing can take up to 2 to 4 weeks if you do it online. And processing, even going into the Social Security office, can take a little bit as well. You can always follow up on the progress of your application by logging in to your account on Social Security. So ssa.gov, you will follow up on the progress of your application. It is always best to sign up for Medicare in the first 3 months of your initial enrollment period, called the IEP. If you do sign up in the months following your birth month, you can delay the start of your Medicare altogether. So if you're planning to start Medicare on the first day of your 65th birthday month, you'll want to sign up in the 3 months prior to that. One of the big questions that I get is, and do I have to sign up for Medicare if I'm working past 65? Well, a lot of my clients get freaked out by there's a penalty, and that's what they hear about. Well, I'm here to tell you that if you choose to stay on your group health plan, you can actually go on Medicare later. You can delay the start of your Medicare altogether. You will not get a penalty if your group health plan is credible to Medicare. Credible means that it provides equal or better coverage than Medicare provides. Now, you can sign up for Part A if you are working on your group health and you are not contributing. And let me say that again, not contributing to a health savings account, which is an HSA. You can sign up for Part A only and decline Part B and get it later when you retire. You still will not get a penalty. When you do choose to get on Medicare later, when you do retire, you're going to have to prove your credible coverage with your employer with Medicare. So there are a couple of forms that I help people and guide them in getting filled out. One of them is called the Employment Request Form, and that is labeled CMS L564. This form your HR will sign, and you'll turn that in along with CMS 40B, which is the Medicare Part B application. Typically, you will walk these in to your local Social Security office. You can also upload them and do this application online. However, a little hint is that it's faster if you have those forms filled out and ready to go and take them in to the drop box to your nearest local Social Security office. And I do help people and guide them of when the time frame is to get these forms filled out, because you don't want to have them filled out too soon. You want to plan perfectly, and your timing is everything. So speaking of timing, when should you meet with an expert prior to getting off of your group health plan and going on to Medicare? Well, rule of thumb, it's not written anywhere, but just doing this with people for so long, it is best to meet with an expert about 2 to 3 months prior to the last date of your employment. So in your retirement planning, also plan to meet with that Medicare expert when you're over 65 going on Medicare. Another thing is that if you're turning 65 and you have the opportunity to stay on your group health, it's also good to meet with an expert to decide which option is better for you. Is it better for you to stay on your group health plan, or is it going to be better to go on to Medicare? Which option's better? Which option is most cost effective? And there's a lot of factors that come into this decision. Some of those factors could be even covering dependents, a spouse that's not Medicare eligible, or maybe even children that you are still covering as dependents. Timing is everything, and planning ahead is critical. Now let's get into the parts of Medicare. This is where it can become a little bit confusing, maybe more than a little bit. There are 4 parts to Medicare, and they all have letters: Part A, B, C, and D. We're going to talk about each of them. Part A is your hospital insurance. Part B is what's considered medical insurance. Part C is the Advantage plan, otherwise known as the Medicare replacement, and Part D is your prescription drug coverage. Part A covers hospital care, skilled nursing, home health, and hospice. If you have worked 10 years or 40 quarters and you have paid your Medicare taxes, there is no premium for Part A. In 2025, the first day hospital deductible is $1,676. Copays will apply if your stay exceeds 60 days, but the average length of stay at the hospital is just 3 to 4 days. Skilled nursing is covered for the first 20 days, and then from days 21 through 100, the copay for 2025 is $209.50 per day. Part B is your medical insurance. This includes all of your doctor visits, your outpatient tests, and procedures. This only covers 80% of your medical costs, leaving you 20% coinsurance without a limit. There's also an annual deductible of $257. This part of Medicare has a premium based on your adjusted gross income from 2 years ago. In 2025, the standard rate for Medicare Part B is $185 per month. High earners will pay an IRMA, an income-related monthly adjustment amount affecting their Part B premiums and their Part D premiums. That's for the drug plan, Part D. Part B premiums are adjusted every year, and this is based on the income from 2 years prior. If your income decreases due to retirement, you may have to temporarily pay higher premiums before they will decrease in retirement. Although there is no guarantee, you can appeal an IRMA adjustment if you believe you qualify. Part C, I would consider the most confusing part of Medicare, and it's called the Medicare replacement. It is otherwise known as the Advantage Plan. Advantage plans are insurance plans that are subsidized by Medicare, and we're going to talk about this in a little bit more detail later on in the presentation. To have an Advantage plan, you must have Part A and Part B of Medicare, and you have to pay your Medicare Part B premiums. These are all-inclusive plans with an insurance carrier with benefits of hospital Part A and medical Part B and Part D for drug coverage. Plus, they have other benefits that original Medicare does not cover. They are network-driven. They are either HMOs or PPOs. They are county and region specific. There are no national Advantage plans. There are only plans in your specific area or state. They can be changed, though, yearly. They can be changed in the Medicare annual election period, which is October 15th through December the 7th every year. Or you also have another opportunity in the Medicare Advantage open enrollment period, which is January 1st through March the 31st. You can change your Advantage plan. Part D is your drug plan, and I seriously could probably talk a whole hour or two on drug plans and how they're set up, but we're going to just touch on the highlights. They are required by Medicare, and if you do not get one when you are first eligible to be on Medicare, whether it's over 65 or turning 65, you will get penalized if you do not get a drug plan when you are required to get one. And some people think that, well, I'm not taking any medications right now, and I'll just get a drug plan later. Well, if you do that, you will get a penalty when you do decide to get a drug plan. And if you decide to wait, there's only a certain time of the year where you can actually get a drug plan. They can be changed, though. We change as we get older. We may have less drugs. We may have more drugs as we get older. So Medicare has opened up the Medicare annual election period from October 15th through December 7th to change your drug plan. And a lot of my time during this time frame every year is evaluating everyone's drug plans to make sure that they are on the most cost-effective plan for them and for the cost of their drugs. Each drug plan that is offered, every state has their set carriers of what they offer, but each plan that is offered within the state has different premiums. They do have different deductibles, and they have different formularies, which are the drugs that they cover. Every one of them is different. Generic medications are generally a low cost, and brand name medications can be expensive on a drug plan. There are a few ways to get a drug plan. You can get one that is through an Advantage plan that has it included in there, or you can get a standalone drug plan through a contracted insurance carrier to provide your drug coverage. You would use this option with Original Medicare Part A and B. Or if you're a veteran, you can use the VA to get your medications, and Medicare will not penalize you for that option. Let's get into the Medicare options. What do you have to choose from when you are on Medicare? There are actually just two options that we're going to cover in this. There's traditional Medicare, or there's the Advantage plan. What makes it most confusing is that there's a million companies out there that sell only these two options. So hopefully we can make sense of either of these options. Let's first talk about what we're going to call option 1, which is Original Medicare with a Medigap plan and a Part D for your drug coverage. That will be the picture of your package of protection on this option. A Medigap plan is a private insurance plan that works with Medicare and acts as a secondary to Medicare A, hospital, and Medicare B, which is your medical insurance. There are two popular plans that you have to choose from. There are many other plans. They all have letters to make it more confusing, but we're going to just touch on the definition and how the two popular plans, Plan G and Plan N, cover you. A Plan G pays the full 20% after Medicare Part B annual deductible is met, and the Medicare annual deductible this year is $240. So once that $240 is covered, and that's what you pay to the doctor or for an outpatient test or procedure, then your Plan G will pay the full 20% that is owed to Medicare. This has no copays. A Plan N, however, does pay the full 20%, and you still have to pay the Medicare Part B annual deductible of $240 this year. Once that is met, you still have a copay at the doctor's office. It doesn't specify which doctor. It's at any doctor's office. You have a copay of $20 for doctor visits and a $50 copay for emergency room visits. So this Plan N does have some copays beyond the Medicare deductible. All Medigaps with the same letter provide the same coverage between carriers. So all Plan Gs, they're all government standardized. So there could be 5 different companies that sell a Plan G. The coverage is equal amongst every Plan G. What's different is the price. Same with a Plan N. The first 6 months that you are on Medicare Part B, there are no health questions asked to get a Medigap plan. So there's no pre-existing conditions that come into play. It's guaranteed issue. But you only have 6 months of a window to get a Medigap plan once the date of Part B starts. There are no networks, there are no referrals needed, and you're able to see any provider that accepts Medicare. So there's really no networks to check. As long as your doctor accepts Medicare, then they will accept your secondary Medigap plan. Your Medigap does not have any drug coverage, so you do have to purchase a standalone Part D plan to cover your drugs. This is required by Medicare, as we stated earlier. Other policies that you may need for your protection that are not covered by a Medigap are dental, hearing, and routine vision. Here is a little demonstration of what it looks like. Like I said, a Plan G is a Plan G, no matter what company that sells it. So if you see, it's like apples to apples. So there are 5 no-name companies right here, and they all provide the exact same coverage, but if you look at the very top on the monthly premium, each of these companies can charge a different price. So if you pay more for a Medigap plan, you're not getting any more than the cheapest plan. It's always good to choose a plan that's stable, that, sometimes the cheapest is not the cheapest for long, but all of these rates with these Medigap plans will gradually increase as you get older. So premiums will increase. Let's talk about option 2, which is the Medicare Advantage plan, otherwise known as Part C of Medicare. These are private insurance plans that are subsidized by Medicare, meaning that Medicare is paying them a budgeted amount of money per month for you to manage your health care. These healthcare costs can then be controlled and the premiums can be lower for you. These carriers that have contracts with Medicare to provide these types of plans do have to follow Medicare rules and guidelines. They can never ask you a health question. They have to cover what original Medicare covers, and they must be approved by Medicare each year. They are either HMOs requiring referrals or PPOs not requiring referrals. They utilize a doctor network, so you do need to take a plan that your doctor takes. They have copays for all of your services, your medical tests, hospital stays, treatments, and they do have a maximum out-of-pocket. So there is a limit to all the copays that you spend or co-insurances that you spend on the plan. There is a limit called a max out-of-pocket. They have low to no healthcare deductibles on these plans. There are low to no premiums on these plans. They do have some extra benefits included, and most all plans include drug coverage, which is your Part D. They include the benefits of your hospital coverage and all of your Part B, which is all of your doctor visits and your outpatient test procedures and treatments, and drug coverage. They can be changed, like we mentioned earlier, October 15th through December the 7th, or January 1 through March the 31st each year. So if you start with one carrier and you want to change it the next year, you can do that with no health questions asked. You do have to keep your Medicare Part A and your Part B of Medicare in order to get a Part C. I know that sounds like a little bit of Medicare math, but you do have to be on full Medicare A and B in order to get a Part C. Here's a little table of what an Advantage plan looks like. You can have 5 different plans in one carrier. It's like fruit basket turnover. So really what guides our choices on this is what your doctors take and what your drugs are going to cost. That's what guides our choices with the Medicare Advantage. They look really similar to a group health plan. Let's do a short comparison of the different options of Medicare. And I know we're just covering the basics, so this is just the tip of the iceberg. There's a lot of education that goes into really understanding the differences between the original Medicare and the Advantage plan, and really trying to understand what option fits you the best and what you feel the most secure in choosing for your healthcare coverage in retirement. Let's first look at an overview of original Medicare. That's where you have Part A, Part B of Medicare, and Part D, and a Medigap. That's your picture and your package of protection. No referrals are needed with this option. You can go to any doctor or hospital that takes Medicare. There's no maximum out-of-pocket to meet beyond the Medicare Part B annual deductible. There are no copays on these plans, namely a Plan G. Remember I said there is some copays on a Plan N. Premiums on this type of plan can increase each year. No Part D is included, so you do have to purchase a standalone plan. And there's no dental, hearing, or routine vision, so you do need to purchase a standalone plan to cover that as well. And that's what it looks like for your original Medicare. Part C is your Advantage plan, and that is when you have Parts A, B, and D all included in a Part C. This type of plan is guided by doctor networks. They are either HMOs where referrals are needed, PPOs where there's no referrals needed. There are maximum out-of-pockets to meet before you ever get 100% coverage. There are copays for healthcare treatments and doctor visits and procedures. These plans are county and region specific. The benefits of Part A, B, and D are included in these plans, and there are other benefits included that original Medicare does not cover. That's a lot of information to take in on the different options, and we just scratched the surface, really, just so you could understand the basic definitions. How do you choose a plan? What is best for you? How do I even go about doing it with a client? So there are some questions that I take each individual through. We talk about their doctors and how important is it to them to keep their doctors? Are they willing to change depending on what the doctor takes? I look at where a person lives. Do they live in a big city area, metroplex area where there's a lot of doctor choices? Or do they live in a rural area where there's not a lot of choices? Maybe not even a lot of plans to choose from. We also take into consideration your budget in retirement. We all know that in retirement, our income is going to level out. We're not working anymore, so we've got to fit healthcare, Medicare into our budget. And so we talk about that. What is your budget for healthcare? Many people haven't even thought of this. How flexible do you want your plan? Are you okay with networks? Are you okay with copays? Are you okay with having a max out of pocket? Are you okay with premiums increasing each year? Do you want to go to any doctor that takes original Medicare? Do you even want to have to worry about a network? So we want to fit you with a plan that is flexible for you, or where you feel is the most flexible for you and you feel the most secure on. The other thing to take into consideration is your medications. How many medications do you take and what do they cost? And is it going to cost a certain amount on this plan versus the other plan? Is it going to cost something different on original Medicare versus the Advantage plan? So some really client-centered research goes into deciding and helping guide a person to the right plan for them. And then also, how important are those extra benefits? Is it a need for you? Is this something that you need in your health care that's going to help you even stay preventative in your health care? So we also take a look at the extras that are provided with these plans and if they fit your specific health care needs. Here are some of the things that they don't tell you. Not all doctors will take Medicare. So it's a really good idea to, if you have a primary care physician, to ask them, what kind of plans do they take? Some doctors may not know, and in a doctor's office, there is an insurance person that is an expert on what that doctor takes and what kinds of plans that they do take. So it's a good idea to ask your doctor prior to getting on Medicare. It can be really hard for someone when they first get on Medicare and they don't have a primary care doctor to find a doctor that will take a brand new Medicare patient. It's very hard to find sometimes a doctor that will do that. Most of the time, a doctor will take a person that has been established in their practice, already a current patient. So ask your doctor, or at least find a doctor if you don't have one now, find a doctor who you understand what kind of Medicare plans they do take when you are first eligible and when you do get on Medicare. For those of you that are working past 65, maybe you're getting ready for retirement and your employer has offered you COBRA coverage for 18 months, which is generally what they offer. Well, Medicare does not consider COBRA credible employer group health insurance. And the reason why is because you're no longer working. So Medicare only gives you 8 months to be on COBRA. If you are on COBRA longer than 8 months, then Medicare can penalize you. So if someone's offered COBRA, that's a really good time frame to really consider our options and the time frame in which is best to go on to Medicare. I said this earlier in the presentation, but if you are working and you are contributing to a health savings account, Medicare does advise you to stop contributing to your HSA 6 months prior to applying for any part of Medicare. And that way, because if you do apply and you're on Medicare while you are contributing to a health savings account, the wording in Medicare.gov states that you could get a tax penalty. So to avoid all tax penalties, just remember you cannot contribute to a HSA health savings account and be on any part of Medicare at all. And then timing is everything. Planning for Medicare goes along with your retirement planning. When should you enroll? How to enroll? You know, it could save you a lot of penalties, and penalties with Medicare do follow you for life. It's not like you get fined and you pay it off. No, if you end up getting a penalty with Medicare, it follows you for life. Here are some of the mistakes to avoid altogether. We don't want to miss any enrollment deadlines. We don't want to miss the enrollment deadline or the grace period, the open enrollment period for a Medigap. That's the guaranteed issue period that begins 6 months after the start date of your Part B. So they don't consider any pre-existing conditions at that time. We don't want to miss that. So we want to, make sure that we are completing our package of protection in that time frame. Not keeping proof of your credible coverage from your employer. If you're over 65, let's say you're working and then you want to change jobs, and that new job offers you group health that you think is pretty good and is comparable or maybe even better, lower premiums or lower deductibles altogether than Medicare. What you need to remember is if you're over 65, before you change jobs, you've got to get that proof of credible coverage from your old employer and then again from your new employer when you're getting into retirement and going on Medicare. So always keep proof of your credible coverage with Medicare so that they do not penalize you. Failing to review your coverage yearly. So people that are on Medicare sometimes don't even know that they need to or can review their coverage yearly. I'm not saying that someone on Medicare needs to change their plan each year. A lot of people don't. But as we change when we get older, I do think it's a wise thing to do, especially on drug plans, to review your coverage. Now, I teach people each year what red flags they need to watch out for when they do need a change of a plan, but it is a good idea just to make sure you're on the right plan. Again, I'm going to say not everybody needs a change each year, but a review is always good. Assuming that Medicare is free and covers everything. Medicare does not cover everything. Medicare does not cover long-term care. That's your nursing home. That's your assisted living. Medicare doesn't cover that. That is out of your retirement, out of your pocket. But Medicare is not free. Remember that I said Medicare Part B is going to cost you a premium, and that is based on your income. Not talking to your doctors. I can't stress this enough. Talk to your doctor. Your doctor may not know, but then again, there's someone in that doctor's office that knows what kinds of plans, what kinds of Medicare plans that the doctor takes. Not understanding how Medicare Part B is billed and how you pay for it. And the reason I have this on here as a Medicare mistake that you need to avoid is if you're not collecting Social Security when you are taking Medicare, you are going to get a bill for Medicare, and it is going to be a quarterly bill. And oftentimes, I have found that people can miss that. You're getting a lot of mail. You're getting a lot of junk mail. It can be easily missed. If that bill is missed, Medicare can drop you. And so you need to understand, and you do this with an advisor, make sure that you understand how Medicare is billed and how you need to pay for it so that you don't miss it and they don't drop you. Let's review. These are some of the frequently asked questions that I have gotten over the years. Now, these aren't all of them. I have a list of frequently asked questions. but let's go over some of the main ones. What day does your Medicare coverage begin? Well, it's always going to begin on the first day of the month. If you're over 65, depending on when you want your Medicare to start, or it's going to begin on the first day of your birth month when you're 65 and taking Medicare. However, if you were born on the first day of the month, like April 1st, your Medicare will begin the month before on March the 1st. How and when do you get your Medicare card? Well, Medicare, when you're turning 65, gives you that 7-month window, the initial enrollment period, 3 months before your birth month, and then 3 months after to get your Medicare ID. You can sign up through your Social Security online account at ssa.gov. So everybody needs that account. The best time frame to start getting your Medicare card or applying for it, if you are not collecting Social Security, is the 3 months prior to you turning 65, prior to that birth month. Remember, if you are collecting Social Security, you will get your Medicare ID in the mail automatically, and you will automatically be signed up for Medicare A and B. What does Part A cost you? Part A does not cost you anything if you qualify for Medicare, meaning you have worked 40 quarters or 10 years, paid those Medicare taxes. And Part B, though, does cost you. It is based on your adjusted gross income from 2 years ago. That is what your Part B premium will be based on. The standard rate for 2024 is $174.70 a month. If you don't take any drugs, do you need a drug plan? Yes. If you do not take a drug plan out, whether it's a standalone drug plan or whether it's a drug plan attached to an Advantage plan, you need to take one out when you're first eligible, because if you don't, you will get a penalty, and penalties follow you for life. And the longer you go without a drug plan, that penalty just keeps on rising. Are all supplements, aka Medigap plans, with the same letter exactly the same? Yes, they provide the same coverage. They're all standardized. So a Plan G, which we talked about, provides the same coverage from company ABC to DFG. If a Plan G is a Plan G, no matter what company sells it. The difference is, though, is the price. They can set the price at different levels. They can also increase their rates at different levels. Do supplements include drug coverage? No, they don't. Medigaps do not include, and I'm using Medigap and supplement. They are the same term, but they don't provide drug coverage, so you do have to purchase a standalone drug plan, which will have a premium per month. Are all Advantage plans the same? Absolutely not. They are all different. Even one carrier can have 12 different plans, and each of those plans are different in benefits, they are different in copays, they are also different in doctor networks. Who has the best drug plan out there? Well, that also depends on what drugs you are taking. So there's really not one best, and we try to stay away from that terminology. It all depends on your drugs, your mix of drugs, as to what the most cost-effective plan is for you. Should you stay with your company plan after you turn 65? Well, that all depends as well. Is your employer paying for your premiums to where you have no premiums? Are your deductibles low? How does that compare in cost to what Medicare can offer you in the cost of Medicare? It's a good idea when you have the option of going on Medicare is to just getting a review and to decide which option is better for you. Lay it all out in the terms of cost. Do you have to worry about pre-existing conditions? Well, when you first get on a Medigap plan, remember there's that 6-month golden ticket window to get a Medigap plan with no health questions asked. If you choose an Advantage plan, there are never any health questions asked. But pre-existing conditions can come into play if you go back and forth from Medigap to an Advantage plan. If you choose the Advantage plan first and you want to go to a Medigap plan, then you will be asked health questions. If you choose the Medigap first and then later choose the Advantage plan, you will not be asked any health questions. Should you get a primary care physician before you go on Medicare? Well, when we talked about not all doctors take Medicare, maybe they don't even take any new Medicare patients. Maybe they only take original Medicare. Maybe they only take Advantage plans. It's a really smart idea to talk to your doctor prior to getting on Medicare. Talk to your doctor and the insurance person in your doctor's office to see what kind of plans that they do take when you do get on Medicare and if they will continue to see you when you're on Medicare. I want to thank you for your time spent today learning the basics of Medicare. You have taken a step in the right direction. Medicare is so complicated and confusing, and it is best done with an experienced advisor, someone that understands your budget in retirement and that has a good understanding of your healthcare needs now and in the future. Next steps for you is to set up your consultation for a review of your personal Medicare plan options and a timeline so that no deadlines are missed. Remember, we don't charge a fee for any of our services, so this process is at no cost to you. Thank you, and we look forward to working with you soon.